and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here is what I bring to you all from the world of medicine. The link between fraud victimization and elevated blood pressure in men. New research published in the Journal of American Geriatric Society suggests that experiencing financial exploitation, fraudulent schemes and scams may raise a person's blood pressure. The study found that fraud victimization was linked with elevated blood pressure in men but not in women. The study included 1,200 older adults from the Rush Memory and Aging Project. During up to 11 years of annual observations, participants were asked about fraud victimization and underwent serious blood pressure measurements. Men showed post-fraud elevations in blood pressure that compounded over time may portend poor health. These findings show that fraud victimization has important public health consequences and underscore the need for efforts to prevent exploitation, said lead author Melissa Lamar, PhD of Rush University Medical Center. The link between preeclampsia and increased markers of brain cell damage and inflammation. Mayo Clinic researchers found that women with a history of severe preeclampsia have more markers linked to brain cell damage and inflammation compared to women who had uncomplicated pregnancies. In the study, researchers explored whether extracellular vesicles or small fluid-filled particles of brain cell membranes circulating in the blood could be found in women years after the affected pregnancies. Using health record data from the Rochester Epidemiology Project, a cohort of 40 women, 33 with a history of mild preeclampsia and 7 with severe preeclampsia, were matched to 40 women who had uncomplicated pregnancies. Compared to the control group, women with a history of severe preeclampsia had a significantly higher concentration of extracellular vesicles that were positive for amyloid beta, which is a toxic brain protein believed to be an essential component of Alzheimer's disease. The presence of amyloid indicates brain cell damage and inflammation. The researchers found that levels of amyloid circulating in the blood also were increased. These markers of brain cell damage and inflammation in the blood of women with a history of preeclampsia may lead to new diagnostic and therapeutic strategies to improve women's cognitive health over their lifetime, says Vesna Garovic, MD, PhD, a Mayo Clinic nephrologist and senior author of the study. The researchers also observed that higher levels of these markers were associated with lower volumes of total grey matter of the brain, which is important for cognitive and intellectual functions. For women who are pregnant, Dr. Garovic advises being aware of preeclampsia signs and symptoms as following. Attend prenatal visits so your healthcare professional can monitor your blood pressure. Watch for sudden weight gain and swelling. While both are typical during healthy pregnancies, sudden weight gain or swelling, particularly in the face and hands, may be a sign of preeclampsia. Contact your healthcare professional immediately or go to an emergency department if you have severe headaches, visual disturbances, severe belly pain, or severe shortness of breath. Because some aches and pains are common pregnancy complaints, it may be difficult to recognize a serious problem. If you're concerned about your symptoms, contact your healthcare professional. Stickers and a smartphone for easy nitrite detection on foods. Nitrates and nitrites give processed meats their characteristic pink color and robust flavor. Although many consumers want to limit consumption of these preservatives because the substances can form potentially cancer-causing compounds, knowing how much is in a food has been difficult to determine. Now, researchers reporting in ACS Applied Materials and Interfaces have developed a color-changing film that consumers can stick onto foods and easily analyze nitrite levels by snapping a picture with a smartphone. To accomplish an easy-to-use nitrite quantification system, the researchers called a film they call Polysen, which stands for polymeric sensor, made of 4 monomers and hydrochloric acid. Discs punched from the material were placed on meat samples for 15 minutes, allowing the monomer units and acid in the film to react with nitrite in a 4-step azo-coupling reaction. The discs were then removed and dipped in a sodium hydroxide solution for 1 minute to develop the color. When nitrite was present, the film's yellowish hue deepened with higher nitrite levels in the food. To quantize the color change, the researchers created a smartphone app that self-calibrates when a chart of reference disc is photographed in the same image as the sample disc. The team tested the film on meats they prepared and treated with nitrite, in addition to store-bought meats, and found that the polycene-based method produced results similar to those obtained with the traditional and more complex nitrite detection method. In addition, polycene complied with a European regulation for migration of substances from the film to the food. The researchers say the new approach could be a user-friendly and inexpensive way for consumers to determine nitrite levels in foods. Rapid at-home prototype saliva test. At-home COVID-19 tests have become an easy way to self-diagnose, but current tests have drawbacks, such as the length of time it takes to get an answer or how accurately the test can identify a positive case. And most of them require the uncomfortable procedure of sticking a swab up one's nose. Now, researchers reporting in ACS sensors have developed a SARS-CoV-2 saliva assay and prototype device that combines speed and ease with high sensitivity. Non-invasive saliva-based tests exist, but they also rely on the slow and specialized RT-PCR approach. A similar method, called reverse transcription loop-mediated isothermal amplification or RT-LAMP, can also detect viral SARS-CoV-2 RNA at a level of specificity and sensitivity consistent with RT-PCR, but it's quicker, cheaper, and easier to use. Therefore, Vihua, Guan, and colleagues wanted to see if they could use RT-LAMP to create a fast and sensitive COVID-19 test that only requires a saliva sample, a palm-sized portable device, and a smartphone. The researchers integrated several steps into one compact machine, which they call the saliva-based SARS-CoV-2 self-testing with RT-LAMP in a mobile device, or SLIDE. Its 5 distinct modules conduct all of the steps needed for RT-LAMP. That is, heating the sample, mixing it with RT-LAMP reagents, carrying out the reaction, detecting how much viral RNA is present, and communicating that result to a smartphone. To use SLIDE, a person simply spits into a vial on a cartridge that they insert into the device, and results are sent to a smartphone within 45 minutes. In lab tests, SLIDE successfully detected and quantitated a mock saliva sample spiked with inactivated SARS-CoV-2 virus particles, as well as a real saliva sample from someone known to be positive for COVID-19. In both cases, the results were consistent with those from RT-PCR, which suggests that the SLIDE device could be a quick, easy, and sensitive way to tell whether someone has COVID-19, the researchers said. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.